Good evening, ladies and gentlemen, and welcome to our online meeting, Learning Lessons from Lockdown in Scotland. The Scottish Committee would normally be meeting to plan our conferences for the coming year, but because of the COVID pandemic, we have had to put these plans on hold. We moved to Zoom meetings like many others, and the committee felt it was important to try and create something for our members and those who attend our conferences in Scotland in a digital form. At this time, the Scottish Government began to ease lockdown restrictions, and we thought it might be helpful to think about how different agencies in Scotland are managing lockdown and moving forward. So tonight, I am happy that we've been able to bring together so many interesting and differing perspectives to answer 4 questions that we have asked our presenters to speak to. I now would like to introduce our speakers. We have Maree Todd, MSP and Minister for Children and Young People in the Scottish Government, Lewis King, a student at the City of Glasgow College, Hannah Mimiec, a student at the University of Glasgow and member of the youth group consulting to the Scottish Government on mental health issues, Dr. Colin Morrison, lead for the Children's Wellbeing Survey Group to the Children's Parliament, Alison Crawford, City Principal Psychologist of Glasgow Psychological Services, Fiona McBride, Assistant Director, Children First, and Dr. Laura Sutherland, Consultant Child and Adolescent Psychiatrist, North of Scotland, Young People's Unit. So without further ado, I'm going to ask each of our panel to answer each of the 4 questions we have posed to them in the order in which I named our presenters. Now, the first question that we asked our presenters to speak to is, what has been your greatest learning experience as a result of lockdown? And I'm first of all going to ask Maree, Minister, to speak to her response to that question.
Hi there. Thank you very much for inviting me along this evening. It's a real pleasure to be with you. It would be a cliche for an education minister to say that everything about this experience has been a learning experience. These are unprecedented times, which is also a cliche, but really in modern times, society hasn't lived through something like this, not quite the same set of circumstances, and everything about it has been a learning experience. So if I think about me personally, I've learned, I already knew I was an extrovert. I've learned that being on lockdown with 6 people wasn't enough. And actually, I really missed human contact. I craved it. I loved getting out for my daily mile and bumping into people. So there's very personal learning going on. I learned I was a bit of a Luddite and all of this new world is tricky. I'm much older than I look, as I tell everyone. And I think like most of the nation, I learned that I don't really like being told what to do. So being restricted is not a comfortable place for most human beings. But actually, now that we're entering a different phase of lockdown and moving out and through it, I find that it is a very anxious time, as I'm now more in charge, and people are, it's less clear cut what you're meant to do, which is the right thing. From a government perspective, we had a huge amount of learning. I mean, immediately, overnight, like every other organisation in the nation, we pivoted to meet this crisis. And you saw people change jobs. So lots and lots of people from my department went into health. And they changed the way that they worked overnight as well. So not only were they doing new things, but they were doing them in a new way. And that is quite something for an organisation that has a reputation for being quite fusty and slow to change. So what we learned was that we can do it. We can be agile, we can change, and we're quite excited about that. There are a few other things. I mean, perhaps we're going to talk more about some of the positives that we learned, so I'll maybe leave some of it for later. Another thing I learned was just how committed some of the individuals in our organisations are. So I am in absolute awe of the cabinet secretaries who are, taking, I feel, the responsibility heavily on my shoulders as a junior minister, and I have told people, it's like a pat line, I have the best job in the world. I mean, I'm Minister for Children and Young People. I'm encouraged to climb trees and play every day. It has been a huge responsibility being a junior minister during the pandemic, and I am absolutely in awe of those cabinet secretaries and senior civil servants who have, done such an incredible job, and advisors, and taken so much of the responsibility. In terms of the country, what have we learned? I mean, lots and lots of lessons. But I would like, one of the things that I think will come from it is that sense of nearly every family in the land has felt vulnerable. And I would like to think, and for many of them, that's a completely new experience. I would like to think that the new world that we're moving into will be a more compassionate place. People will be less harsh about each other's family circumstances. There'll be more of a humane response to some of the difficulties that families face. There will be more of a sense of all being in it together. So there's been a phenomenal amount of learning, and I'm looking forward to talking in more detail about all of these things as we go forward this evening.
Thank you, Maree. So we now move to Lewis, who's going to give his perspective, what he's learned from lockdown.
Hi there, yeah, I'm Lewis. I'm a creative arts student at Glasgow, and so my situation was I was working, studying, and living in Glasgow, and then now I'm not, and everything's shut from a learning point of view. You know, my college. I mean, we saw it coming, but eventually it came to working at home, which is quite difficult for creative arts, and we have to use all our tools and have access to certain things. And also work. I work for an events business. You know, I put on shows and events, so that hasn't been fantastic. And I think from all this, I think like the main thing that I think what I've learned, but it's quite like an internal thing. I think it would be quite hard to write down specifically what I've learned, but overall, I think I've gotten better at dealing with the lack of control. So I think I'm quite a free, easygoing person as it is. You know, I don't need control over a lot of things, but I think it's nice to have the option to have control, and I don't have that option at all for so many things. So I think I've gotten better at identifying like where I don't have control, and then from there figuring out what I can do with my time. So for instance, I can't go and see any of my friends really, but I can call on people and see how people are. I can't go to class or I can't go and work, but I can figure out different ways to keep myself, my brain active and myself awake and my body active. So I think that's probably the main thing, is just figuring out what to do when you don't have control. And again, it's quite an internal thing. You can't really write it down. I'd say that's the main learning experience that I've picked up over the last few months.
Thank you, Lewis. Hannah, next. What have you learned from lockdown?
Sorry, my computer's strange. I would say, obviously like Lewis, I went very quickly from being at uni, just kind of living life, studying away, to having to move home very quickly. And it's only just now that I've been able to come back to Glasgow. And again, I think that loss of control and stuff was a really weird thing. But I think one of the biggest things I noticed during lockdown, especially right at the beginning, was like the amount of information and like news and things that we consume every day. And I think, especially at the beginning of lockdown, where there was suddenly nothing to do but sit and watch the telly and sit and listen to the radio and watch every briefing that was happening every day. I think I learned after a while that, like, for me personally, as someone that is quite a big worrier, that seeing all this stuff and hearing all these things all the time, while it might be useful to know what's going on, especially right now when guidelines and things were changing all the time, it isn't healthy to be hearing about all this stuff all the time constantly and having it on your mind a lot, like all the time, when there's, again, very little you can kind of do about it in a lot of ways. So I think one thing that I really did have to learn was about being more intentional with like what I'm looking at, and when I'm going on my phone, and I had to do things like deleting Twitter off my phone and Facebook, because you would just pick it, because you were just also used to picking it up every day and seeing something else that's horrible that's happening in the world. I think this actually made it, after a while, kind of getting into the practice of just being a bit more intentional with everything. It made it a lot easier to cope when seeing things on the news and stuff, but also made it easier to like actually understand what's going on, because when you're in a headspace to like receive kind of what can often be quite distressing information and things, but it's still important to learn about. And yeah, I would say that's like probably one of the bigger things that's been a learning experience for me.
Thank you, Hannah. Colin, your turn.
Hi, hello, good evening. I suppose my learning experiences have really been more like reminders rather than something new as such. So with the support of Scottish Government and Public Health Scotland, we've been engaging children aged 8 to 14-year-olds in a national wellbeing survey called How Are You Doing? And we've also had a number of children writing about their lockdown experiences in the Corona Times Journal. So we've had 3 large monthly surveys and 5 journals published. And they've reminded me really that children are mostly resilient and adaptable, and they've fared relatively well through this. And that most children also live in families that have been doing their best for them, you know, regardless of struggles that they may have had juggling work or financially. But I've also learned, well, again, it's maybe more of a reminder, that for a number of children, home life is difficult. And so in current circumstances, for example, learning was never going to be an easy ask for them. So it's as if for those children, existing poor experiences have been even more exposed or compounded. And so it's those children that I hope we can think more about, even though in the reporting that we are doing, we're saying, you know, 80% of children are successfully whatever. It's the other children that we really need to pay attention to. So I'm kind of resistant to talking about returning to normal, even a new normal, because I think normal just wasn't good enough for many children and families. So personally, there's been some learning for me as well. I do a lot of work from home, but this has been a much more intense experience. I would have said I'm quite happy with my own company, but I've missed people, colleagues and family and friends. And the last few weeks I've had a wee bit of anxiety about getting back out there. Even those first initial meetings face-to-face with people I know really well, it's been a wee bit of a, oh, right, this is happening again. You know, I'm going to be late, I'm going to be on time. I'm a wee bit anxious about where we're meeting. And it just reminds me that there are going to be a lot of children, including those that we thought were doing okay with school, for example, who are going to have real anxieties about getting back out there. It's going to be challenging for a lot of children.
Thank you, Colin. So Alison's turn.
Hello, yes, I've been nodding in agreement to so much of what people have said already. And Maree, I also really missed my colleagues. I learned how much I need that personal contact with people and the really special energy that you get when you're working together with people who are creative and who are trying to construct solutions together. So that was something that I really missed and learned about myself. Other personal reflections, the ebb and flow of the working week was entirely different because we were now working from home, and that Monday-itis feeling, that became very real and difficult to slough off because I wasn't with my colleagues. So I'm having to now think very carefully about what I do on a Monday morning to try and counteract that. Other things that I've learned personally is keep communicating. So leading a large team of psychologists in Glasgow was absolutely essential, that we were able to get clear, concise, consistent messages out to everybody in that team in a way that they were able to take those messages and apply them to their work. That the team themselves have been remarkable. I think, like teams of psychologists up and down the length and breadth of the country, they've proved to be extremely agile, very able to adapt quickly to a very rapidly changing situation, while they were managing their own personal circumstances. And I think we had to really keep that in mind as well. Many people who were working from home were also trying to manage childcare, home learning, concerns about themselves and about their own relatives and neighbours. So trying to keep that in mind for everybody was something I think we achieved pretty well as a team, and my sense is that as a profession we've managed that across the country. We also learnt rapidly how to get the best of psychology out to the biggest number of people that we possibly could in the shortest possible time. So we had to think really quickly about how we used social media, how we improved our website. We're going on to talk about things that we've learned, but we got a lot better at linking with the local press, filming, using infographics, that kind of thing. So for me, very, very privileged to be part of that team of educational psychologists, not just in Glasgow, but across Scotland. The Glasgow experience itself, learning from that, and I think this will have been replicated across local authorities across the country, is that when we're under the cosh, we can respond very quickly, that we know who our strong partners are and that they will respond along with us. So for example, I found myself in the city chambers in Glasgow stuffing farm food vouchers into envelopes so that we could get money out to families in lieu of school meal entitlements as quickly as we possibly could. So there was that sense of whatever needs to be done, we roll our sleeves up and we get it done, and that happened remarkably well. The other piece of learning for me on a citywide basis was that we have invested heavily in high quality professional learning for ourselves and for our teaching colleagues, and that has been done over a number of years, and that stood us in really good stead as we moved into this completely novel situation. So we were able to say to people, we're not needing particularly new learning here. What we need to do is go back to what we know works, what we know about children and young people and what their needs are, and what we know about how we maintain relationships, even if it is at a distance for the next few months. So in Glasgow, we've done a huge amount on nurturing principles, understanding child development, trauma and attachment. And that all kicked in very quickly as schools started to think about how they supported their families, albeit remotely. And we're seeing that coming through pieces of research that we're doing now. So lots of learning there about you get the foundations right and they carry you through whatever comes your way, even the most unexpected of situations. And the role of community. Again, communities have responded wonderfully to this situation. Maree, you talked about, we hope that we emerge from this with more compassion and more care and a more humane approach to understanding what we all need. I think we saw that happening on a community basis, where people rallied round, delivered meals, got prescriptions, knocked on the doors of neighbours, delivered baking, made phone calls. A phenomenal response from people who were living side by side up tenement flights of stairs with each other, just to make sure that our very basic human needs were being met. And finally for me, I was really privileged to be part of the British Psychological Society COVID coordinating group. So this was something that was pulled together again very rapidly to bring together all the different disciplines of psychology across the UK to look at how we could support our colleagues, how we could support fellow professionals and how we could support families. And what we learned from that was we can network very effectively, very quickly, and get the best of psychology out rapidly so that we can support our colleagues and also help people like Maree who are having to take strategic decisions and put strategic plans in place, so we can make psychology available to people quickly in a way that's accessible and digestible to help that decision making. And I think there was a real lesson there and how we can mobilise a profession around a single concern and get the very best from each other out of that. And that's learning that I hope we take forward from this over the coming weeks and months.
Thanks very much, Alison. Fiona next.
Hi there. I suppose I would just echo a lot of the sentiments that colleagues have already expressed. So that the one thing in Children First that we learned very quickly was, and were able to adapt to very quickly, was about that need for flexibility and agility. So with children, young people and families, we were able to really quickly ensure continued contact with all the children and families that we'd contact prior to lockdown, right throughout lockdown, through the use of phones, video calling technology, but also garden visits. Also a lot of delivery of practical support, such as food, activity packs and lots of different household items. We were able to quickly prioritise the families that required more frequent and face-to-face, but at a distance, support, and those who required less frequent contact and different forms of support. I suppose the other thing was because, as a result of a reduced reliance on travel, we were able to significantly increase the number of families that we worked alongside, because less of staff time was taken up with driving and getting to different places. So we were able to really get alongside more families during lockdown than we had been before. Our colleagues in fundraising and Children First also mobilised an urgent assistance fund very quickly to raise money to meet the practical needs of children and families, which was very evident throughout lockdown, so that was really helpful. In relation to flexibility and agility in relation to our staff and the organisation, we've also used video technology, as we're doing this evening, to ensure continued and frequent support to all of our staff at all levels within the organisation, and that's been really important to hold our staff and colleagues during this time, because they've all been dealing with all the things that people have mentioned earlier on about their own situations and their own fears and worries. So we held very frequent Teams meetings and supervision sessions, so more frequently than we would have done prior to lockdown. We ensured that our organisational message was communicated clearly, with daily emails from our Chief Executive to all staff during the first few weeks of lockdown. Our staff have highlighted that they benefited from the ability to be more flexible in their work patterns, to accommodate working from home and their work-life balance. However, like other people have highlighted too, they've also identified the wish to go forward with a more blended model of home and office working, just to promote improved connection.
Let's move on to Laura.
Okay, hi. So I suppose my overall working week didn't change very much because of lockdown, because I work in the NHS. But I think our ways of working changed very drastically overnight. So I work for a young people's unit for young people with mental health problems that covers the north of Scotland. And I would like to think, because we cover such a large geographical area, that we are quite good at using technology to aid people who live quite far away. But actually, one of the things I learned quite quickly was that we weren't as good as we thought we were, and kind of really overnight we had to get to grips with lots of different types of technology. And I know we're going to speak about things that we'd like to keep, but overnight we started doing kind of family therapy sessions via kind of near me video consultations. We were kind of professionally with other psychiatrists, we were doing kind of Zoom meetings, and then moved to kind of Microsoft Teams meetings. I think clinically as well, like I felt that I had to upskill quite quickly. So although obviously with a medical background, we are all trained in sort of recognising physical illness, for me it had been kind of 10 years since I thought about things like that. And obviously it was a concern that how would we kind of recognise somebody in the inpatient setting who was deteriorating. So I found that very quickly I had to do kind of a lot of relearning things that were quite out of date for me, just that I could be confident if we came across anybody who was unwell with COVID, that we could recognise those symptoms. I think in terms of kind of the NHS, sometimes it can feel in the NHS that things are quite slow to change. But actually, one thing that I did learn is that when there is when a change is necessary, people can come together very quickly and make quite rapid changes in the NHS. And it's something that I was quite proud of, that there were different groups of people meeting daily and kind of changing all our sort of policies and procedures and reacting very quickly to what was quite a rapidly changing situation as well. I think from a sort of personal standpoint, I'm a person who likes to sort of fill my life with lots of events and have quite busy weekends and evenings. One of the things I kind of learned from a personal standpoint was to slow down a bit. So instead of kind of spending the whole weekend rushing about to various events, I actually quite enjoyed doing things like going for long walks with my family. And for me, actually, I found actually I was spending more time with my immediate family rather than kind of less time. I think as well, like echoing what other people have said about social media, it's something that I do use quite a lot. But again, I think what the lockdowns taught me is to maybe limit some of the social media that I've been using, because even for myself, it was quite overwhelming at the start and things were changing so quickly. And probably like other people, it was quite frightening. You weren't quite sure what was happening. So I think like chunking up social media and learning just to look at it maybe kind of once a day or look at the news once a day was quite helpful as well. Thank you.
Thanks very much. Very interesting. We're not going to have time to do a discussion, but it's wonderful. I would have loved to have got into a discussion. Maybe another time we'll meet up again. So question 2 is, what have been any unintended positive consequences you have experienced? What will you keep as part of your everyday in response to lockdown? So again, Maree, to kick us off for that question.
So whilst I agree with Colin, so one of the things that really troubled us about this whole situation is the exacerbation of inequalities, and a lot of our focus has been on where things aren't going well. Undoubtedly, there have been things that have gone really well. And you know, one of the things Alison mentioned, the sensation that everybody in the country just rolled their sleeves up and did what needed doing, that's a phenomenal response. And that happened from individuals on the ground, communities, organisations, local authorities, government, everything. Everybody just pitched in and did what needed doing. And that is a strong position for a country to be in. One of the consequences of that was that some of our most vulnerable families, and I do hate that word, but we're struggling to find a different one, but some of the families who face really complex challenges and have layers and layers of intervention and bureaucracy and support in their lives, instead of us giving them this complex web of support that was designed by us, we just pitched up and said, what do you need from us? And they got a kind of support that they've never had before, and that was better for them. So we're pretty keen to try and hang on to some of that learning. It is, you know, sometimes we're adding huge layers of complexity to people's lives when they're already vulnerable, and asking them to use bureaucratic systems to find support. And actually that pitching up in the third sector were phenomenal at this, just pitching up alongside people, not necessarily physically in the situation that we're in, but metaphorically pitching up alongside people and saying, what do you need? What help do you need? And that has been really, really good. In terms of IT, like everyone else, I mean, you know, it's a real bless. I have a job that takes me away from home a lot, and it's very busy. And actually, it's been a real blessing to be at home more. Now, there's a downside to that. I don't think you can do everything online, but actually thinking more carefully about how often we need to be away and how often we physically need to be in meetings, I think will be a really important part of what we think. You know, when I think of my carbon footprint last year compared to this year, it's phenomenal. And, you know, the impact that that has on my family time, and, you know, whatever else happens, I will, and I'm a mum of 3 children, 20, 18 and 16. And we had one extra child. So at the beginning of lockdown, my eldest daughter's flatmate came to stay with us as well because his mum was shielding. So we had a busy family house. And I will think forever, however tough it was being 24 hours a day, 7 days a week in the same building, I will think that's incredibly precious time. Those children at that stage of life should not be under the view of their parents 24 hours a day. They should be much more independent and, you know, out pushing boundaries and kissing frogs. So I know it was precious time that we wouldn't have had together other than from the circumstances that we were in. And, you know, from a personal perspective, I'm sure I will always look back on that fondly. We ate more meals. I mean, I complained bitterly. Every day was like Christmas, you know, punching out these massive banquets every night. But we ate more together. And these things, you know, these precious experiences and these communal experiences are quite common throughout the country. In terms of nationally, I mean, I think we found a great deal of resilience, a lot more resilience in some places that we, you know, never expected to see. And that's a really precious thing. And we have to think carefully about, you know, how do we make, why are we generally organisations, not just government, making things difficult for people, you know, and we need to think more about how to make it easier for folk. Some of the things, you know, specific things that I've really been impressed by. When somebody mentioned NHS near me, I think it was Laura. Now that's a thing that started in the Highlands and Islands. I'm a Highlands and Islands representative and I'm a health professional by trade, so I've always been fascinated by that. It has been really hard to introduce even in the Highlands where we really need it, because anybody having to travel to Inverness is, you know, trekking quite a long distance to seek the medical support that they need. And it took a pandemic for that to be widely adopted. And it's widely adopted not only in the Highlands, but also throughout the whole of the UK and in the Republic of Ireland. And it has been a phenomenal success. And, you know, from what I've seen, they are noting not just a reduced carbon footprint, which we're all interested in, but an empowerment of patients. And, you know, we're seeing something similar in the way that the virtual children's hearings have worked. So there's something about people being in their own homes, faced with a bureaucratic system or, you know, a paternalistic relationship perhaps with medicine, certainly a difficult situation if you're in a children's hearing, and they feel more empowered and they feel bolder. And from a health perspective and a human perspective, that's definitely a good thing. So we will be very interested in trying to ensure that these power imbalances, which make life difficult for people, are more equalised in future. And I think that will give us some real benefits going forward.
Thanks very much, Maree. Lewis, what have been the positive consequences for you?
I think I share quite a lot with Maree there. About how I've had to reevaluate, I guess, how I live as part of the relationships I'm in, and kind of how I live in the communities I'm in and the groups and, you know, friendship groups and my colleagues and so on. So, for example, you know, right now, so I'm at home with my parents and they're both working, and I'm not, but we're all stuck together. So now I don't have the opportunity to, you know, go out, do my day. I'm at work, that's what I'm doing, or I'm in class, that's what I'm doing. Now I have to find another way to kind of spend my time. And I think if this wasn't lockdown, if this was just some long weekend and my parents were still working or something, I would probably have not done very much. But now I'm having to figure out my balance of how much time I spend with people. I'm quite introverted. You know, I do appreciate my own time, kind of like Colin said, I guess. But before, I thought that it was, I need to speak to people more. I need to speak to my friends more. But it turns out I just need to be with them more. I'm still speaking to quite a few of my friends, you know, lots of phone calls. But I think what I really am missing is just being with people. So, for instance, when I was, I had two flatmates. I spent most of my free time on my own, and the only time I really spent time with them, you know, shared like a communal time with them, was eating some nights and the odd film or the odd game or something. But I think that my new everyday, hopefully, should involve a lot more being with people, you know, spending the time with the people. Even if that's watching a film, you're not talking to anyone, but you're sharing the space and sharing the time with people. And I think that's way more important than I ever could have figured before. for your mental health and for your existence. Like you really can't just be on your own the whole time. And yeah, like it's really made me reevaluate how I split my time with people. So I think my everyday new is just going to involve a lot more thinking about right now, do I spend my time on my own? Do I take my meal to my room, or do I just be with the people that are the closest to me? I would say that's my everyday new.
Very good. Yeah. And Hannah, what's your new? What positive consequences for you?
I think one of the biggest unexpected positives was the amount of time I've gotten to spend with my family during lockdown, because I'm in third year now, and so I kind of never imagined that I'd be spending anywhere close to the amount of time I spent at home ever again. So suddenly being with my family for 3 months, nearly 4, almost non-stop, was weirdly very nice. Because I still had uni work, and my sister was still studying for her exams when those were supposed to be happening, but got cancelled. And like my parents were both working as well, so we were all still kind of doing our own thing, so it wasn't ever overwhelming, which is really nice. And it was just like in the midst of a lot of really quite horrible stuff going on in the world, obviously, like having to get to be around my family and stuff, I think was really nice in a way, because obviously those are the people that know you best, and sort of we're able to support each other a lot better than I think I probably would have been with any other group of people I could have been with during that time, which was really lovely. I think then the other main thing that was good, and definitely the main thing that I'm gonna keep as part of my everyday going forward, is slowing down a bit. I am an introvert, but I'm also a very busy person, between uni and different societies I'm involved in, and trying to have a social life and also sleep. I kind of don't stop a lot during term time, so being sort of forced to a point that I would usually be really busy was actually kind of a blessing in disguise in a way. And I think I've learned that as well, that just like the importance of, obviously maybe I won't do it for 4 months, but like taking, a full day just to sort of be by myself and recharge and things, because that has actually helped a lot, and a weirdly good thing.
Thank you, Hannah. Colin.
Hi. As an organisation, we moved quite swiftly to using Zoom to connect with children. So our kind of mostly 8 to 13, 14-year-olds. And that's gone really well in terms of we had a number of consultations or programs that we were in the middle of when lockdown happened. And it's worked fantastically well. A lot of the children we work with don't always find school an easy place to be, and maybe we were meeting them there before. And actually for some of them, that kind of being at home is something that they've enjoyed. They've been less stressed. They've had a bit more control over their lives, which they've enjoyed. Parents have been less stressed because they are. So obviously there are other ways of managing all that, but certainly some of our children have felt more relaxed about being at home. And so their participation with us has picked up. Clearly there were quite a lot of initial issues for some children about connecting by the various platforms, but along with some great work with teacher colleagues, we managed to sort them quite quickly for most children that had sort of digital access problems. So we'll probably keep a lot of that online engagement with children. That's really worked for us and for them. And we've also realised that we can kind of connect directly with children and families. So the How Are You Doing survey, for example, has relied on children engaging directly or with supportive parents and carers. And I think we'll be a lot more confident now about building direct relationships with children and families, and a bit less dependent on engaging through schools or other partners. And just finally, as a team, we're really likely to keep that mix of office and home-based working. I think it's really worked well for a lot of people. It needs a balance, because if it's overwhelming, that's not good. But if we are finding that balance, I think that's something we'll definitely keep a hold of.
Thank you. Alison?
Yeah, so personally, since we've been able to move around a bit more, I've taken up wild swimming. So that was something that I would never have foreseen prior to lockdown. So through that, I now have a completely new group of friends that I'm meeting with. and really enjoying that lovely liberating sensation of being out in our fabulous Scottish countryside. So I would never have guessed that would have been a consequence for me. Like others, my carbon footprint has reduced drastically, both in terms of the amount of travel that I'm doing, but also in what I'm consuming. So being at home, not being in and out an office and in and out a city centre every day has meant changes in what I wear, what I eat, what I carry with me, and I'm hoping that some of those changes, those differences will be sustainable over the longer term, and I can make permanent changes in some of those areas. Professionally, we now have many new relationships, so with the local press, with educational psychologists right across the UK, whom we might have known their name, but we certainly hadn't had conversations with them before. So now we've got really strong, positive professional links right across the 4 nations that can only benefit our children and families. And I'm going to sneak this in. The other nations really envy what we have in education and in our communities in Scotland, and we regularly are told, oh my goodness, we wish we had what you had. So go on, Scotland, good for you. We have seen relationships with, yes, I don't like that word vulnerable families either, but what we've seen through the contacts that our schools and nurseries have had with families is those relationships with some of our most challenged families strengthening because the conversations were different. So conversations about really basic survival needs and safety needs, some of those very early needs that we all have were central to conversations that school staff were having with our families and when they could with our children and young people. So much deeper relationships that I think will stand those establishments and those families in really good stead as we introduce children back into school and try to get into some kind of more normal pattern for our families there. Colin, you talked about learning at home. And how for some children and young people that managed to reduce stress that had been there previously. So I think for some of our children, that more blended model and access to different forms of teaching will continue and certainly will be a feature of how we help those young people transition back into school and make adaptations. So we are hoping that we don't lose that learning. That for some children and young people, learning from home is a positive experience and helps them with some of the socially based anxieties around school and being with your peer group. We've had much wider access to families and colleagues via social media, much more extensive sharing of ideas and resources. So we would hope that would keep going, not something that we would have foreseen. But in order to do that, our team has had to develop a whole new skill set. So we are now making films, getting them out there on Twitter, taking information and putting it into a much more accessible visual format so that children, young people and their families, wherever they are in the country, can access that and use that. And interestingly, one of the core functions of an educational psychology service is research. And it tends to be a function that can get overlooked or sidelined because we're just so busy delivering on all the other things that you would expect educational psychologists to deliver on. But the research function is really coming to the fore now because people want to find out what the experience has been like, what new learning there is there for us, and how we can take that and use that and build on that in the future.
Thank you, Alison. Fiona?
Hi, hopefully you'll hear me okay. So again, personally, like others, it's been nice to spend time with my 2 daughters. One's 21 and was at uni, one's 11 and was transitioning between primary 7 and S1, so that came to an abrupt halt, but it's been nice really to spend some time at home with them. From an organisational perspective in Children First, although it did become intended, I think, like others, the success of the increased use of social media and video call technology wasn't really expected to the extent that it has been successful. Although we're really careful and have been very careful about the use of social media to connect directly with young people and families, we found that in consultation with them, and I think one of my colleagues alluded earlier on, that they enjoy that interaction through video calls, because actually they often feel a lot more in control of that interaction with another person. It takes place in their own home, where they're more comfortable, and they can switch you off, I suppose, if they really want to. Thankfully not many have, but we found that's been really successful. We've also started a number of closed social media groups in some of our services where children and families can communicate with one another and give one another some ideas and some nice aspirational quotes and ideas for activities. So I think there have been some clear drawbacks to engaging children and young people and families through those, but many have embraced it. So that's been really helpful. The other thing in Children First that we've learned is that we've also used our collective resources within the organisation to the maximum benefit across all of our services. So one example is we had 3 money advisors in 3 of our local services prior to lockdown. But during lockdown, we pooled those resources and offered money advice to families right across Scotland, right across all our services and through our national family support service, Parent Line Scotland. So that's been learning for us, that we don't just keep our resources in some local areas, that we can really pool them very quickly to the benefit of children and families right across the country. The things that we'll take with us into our everyday, I mentioned earlier on about that flexible approach to supporting children and families through a blended use of technology and face-to-face meetings, a flexible approach to staff working environments, so again that blended approach between home and office-based working. Video call meetings, I think we'll probably continue to do even when we are able to travel. I think people have already mentioned carbon footprint and time and all of those things. So I think we'll continue to do that, continuing to pool our resources across the organisation to ensure that we can benefit the maximum numbers of children and families across the country. The other big thing that we learned in Children First was about continuing to increase the provision of practical as well as emotional support to children and families, particularly since there's a very clear link between material and emotional well-being, and that was very clear during the pandemic, and also the benefits of establishing and developing relationships with families through the provision of practical support. Sometimes it feels quite scary for families to engage with us when they think that they're coming for something that's going to talk about their feelings and how their family functions. But actually, if you can initially engage through providing practical support, that can start off a relationship where they later feel more able to talk about the things that are a bit more deeply ingrained for them or make their life a bit more challenging.
Thank you, Fiona. And Laura?
Thank you. I think from a personal standpoint, one of the things I did notice in my local community is actually, despite people being actually physically distanced, people came together a lot more. So in my local community, people were doing things like putting the rainbows on the windows, but actually people kept that going. So there was something for, I'm the mum of 2 young children, and we'd go out for walks and look at different pictures every day. Or within the school community, there was one mum who'd drawn pictures of the children and put them up on the playground for everybody to look at. So again, so even when the children weren't seeing their friends, they were able to kind of see pictures of them holding hands with their friends. I think as well, like I saw a lot of kind of kindness as well, people making various things like making masks and leaving them in little plastic envelopes out of bus shelters for people to pick up. So my hope would be that we would keep some of that kind of connectedness in the community. From a kind of clinical standpoint, I think the thing that kind of stands out to me is the use of technology. Again, I think people have spoke about kind of the carbon footprint and reducing the need to travel. I do various second opinions around Scotland, and if I'm driving kind of to Glasgow and back again, that could be kind of 3 hours of travel and 1 hour of interview. And I was quite sceptical at first of the use of video conferencing to interview patients, because one of the things I look at is people's body language. So I wasn't sure how well that would work. But in some cases, I think it's actually worked better. I think when it's face-to-face and you're wearing masks, it's very difficult to see people's expressions. Whereas if you're using video conferencing, actually, that can actually be better. You can see more of people. And I've seen a range of young people with kind of moderate to severe learning disability, autism, various kind of mental illnesses like bipolar disorder or psychosis. And in pretty much every situation it's worked quite well. I do think it's limited. I know that some young people won't manage that, but I think on the whole, young people have actually preferred that. I think other people have said it's a great kind of equalizer, that it's very hard if you're struggling in an interview to get up and leave the room. Whereas if you're doing any kind of video, you have the power to end it, and it's much
easier for young people. And I also think young people are better versed with technology anyway, so it kind of suits them a bit better. I think as well, in terms of, I mentioned that I work kind of across a large geographical area, so we do have kind of a lot of meetings where the meeting is based in the young people's unit, but we have a lot of people video conferencing in. But we actually switched to everybody using video conferencing. And I did find that actually it changed kind of the format of the meeting, and it felt like everybody had more of a voice rather than there being kind of one main base with lots of people speaking amongst themselves, and the people who were video conferencing in just, I suppose, more kind of observing the meeting. The other hat that I have is I organise the psychiatry teaching for medical students in third year. And again, I was quite sceptical of doing things like pre-recorded lectures or tutorials online. But again, it was something that I was proved wrong with, and something that I'd be keen to keep, that it's actually great to be able to record a lecture in the evening in your own time, in a much more kind of comfortable environment, and upload that for students to watch at their own time and their own pace. Similarly with tutorials, I've done kind of both live tutorials and pre-recorded tutorials. And with the live tutorials, it was a bit odd at first, kind of speaking to my laptop and not being sure if people were listening. But I did find that actually I probably got asked more questions, because again, I think people worry about looking silly, but if you can just type a question in the background, it's more anonymous. I think it's easier for people to learn like that. So yeah, I think kind of the community is coming together, and kind of the use of technology in the workplace are the two things that I would most like to keep. Thank you.
Right. Thanks everybody. So we'll come to question 3. We're moving on a pace. We're a wee bit behind. Can I just check if people can stay past 7, or if they have to go at 7?
I'll have to go at 7, sorry.
Right. Oh, that's okay. So we'll maybe we'll try and maybe put the question 3 and 4 together. If each person can just sort of, as they are slightly linked anyway. So question 3 was, what are your plans for recovery within your organisation or your peers? And what will your organisation be doing to support children and young people to manage the new norm? So Maree, your turn.
Hi there. I guess for me as a junior education minister, the focus for much of the time that we've been locked down has been getting schools and early learning and childcare up and running again. And next week is the big week where that starts again. So there will be a lot of focus on that, both from us and from everyone in the country, and I'm hopeful that we can quickly build confidence in what we've put together, and people will get the hang of that new normal. Most schools, or many schools, are phasing children, so bearing in mind there's an entire year of children who won't even have been in the building yet, going to primary school and going to secondary school. So most local authorities are phasing and then going for full-time education for all a week or 2 into term. And I'm really keen that that goes smoothly, that people feel confident about how it works, and that anxieties are quickly soothed, because not having children in school has been one of the most devastating impacts of this pandemic, and it is something that we really need to learn to do safely in future. For all the benefits that there have been for some children, I think almost everyone would agree we are really, really concerned about the harms occurring to children with not attending educational settings. There's a few other things we need to pick up. So I said that the government totally pivoted towards health. So things like the children's hearing system, which, you know, at the heart of that are some of the most vulnerable children in Scotland. We are about 30% hearings of the normal level of hearings happening, and we really need that system to pick up and be more able to move forward. Probably virtual and face-to-face and hybrid arrangements will all be important, but there's obviously, as there is with the other legal systems, a backlog also to be tackled. So there will be a lot of prioritisation and focus on that. The care review promise. So just in February, it's been such an important part of this government's work, has been looking at the situation that children who are in care of the state face and how we can improve their childhoods and their experiences. And the care review reported in February, and we are very keen to deliver on that promise. We have next month, it's usually at the beginning of term, but we're starting early. We haven't really stopped, I have to say. But formally, we're going back to Parliament next month. But Programme for Government, I think, is going to be in the first week of September as usual. I'd like to hope there's some really radical ideas in there. There's some really, I talked about some of the lessons we'd learned and some of the progress we had made, which we've been trying to do for over a decade now, and suddenly this pandemic created the situation where that was possible. So I'd like to think there'll be some radical stuff. And of course, one of the big headline things for me and for the education team looking out for children and young people next year is the incorporation of the UNCRC. And that's a big deal, which will hopefully put children's rights right at the centre of everything we do, both as a government and as organisations, for, protect that rights-based approach well into the future. In terms of helping children and young people, oh boy, like how to adapt to the new normal. I think that is going to be a bigger challenge than lockdown. So, I said at the very beginning about how I learned about him, and it wasn't news to me that I don't like being told what to do. I kind of knew that about myself, but what has been a surprise is that actually that was a more comfortable place to be. And I think that how many of our children and young people feel like that, actually it was much more straightforward when we were just locked down. And we're finding now as we move forward, I mean, it's not children, it really is about young people. So 20 to 40-year-olds, around half of the people newly testing positive now are in that younger age group. And it is very, very difficult to make that transition and support people in making good decisions when we know. I mean, I said, I'm a parent myself, I've been young. It is awful to be stuck at home with your parents 24 hours a day. It is a very difficult situation at a very difficult time of life when you should be out forging new relationships and pushing the boundaries in your independence. So I think that's going to be a real challenge. But I think we can rise to it, and I think that things like the daily briefing are very important. Things like the support we're getting from psychologists who advise the government in how to communicate well and how to communicate to certain populations. Vitally important. Communication's not a nice to do anymore. This is life-saving stuff. It is the difference between life and death when you communicate well, and giving mixed messages is dangerous. So that clarity of communication is really powerful, and I'd like to see that will continue, even though the complexity that we face is greater now.
Thanks, Maree. Hannah, maybe we'll come to you because you've got a time limit. So you just want to say about, your plans for recovery for the future for yourself and your peers, I guess.
I think one of the big things, so I'm at uni, I'm involved in the management of 2 student societies, and I think one of the big things, and that a lot of the events that we hold form like a lot of the sort of staples in like our social lives and things, because we all know each other, and that's like how a lot of friendship groups and things form. And so I think one of the big things that I've been starting to think about in terms of like myself, but also my friendship groups and my peers and things, is how we're gonna navigate not quite knowing what the next year for us is going to look like, because we've been told that we can go back to campus, but we don't know entirely what that looks like, and also with changing guidance and things, like what is safe to do, what is sensible to do and things. So I think one of the things that we've been kind of, and myself personally, I've been thinking about a lot is like, what's a way that we can try and strike a good balance between, being able to help people to have a good time in the coming months and stuff, but also like keeping them safe and keeping them feel safe as well. Because, I'm anticipating that that's probably a thing that a lot of people, and I can speak for myself on this one, are kind of a lot worried about, is that, with something like a disease that we can't really conceptualize, as I'm not a sciencey person at all, like how to make people feel safe and to like feel secure and stuff, and that they're not putting themselves or anybody else that they know or like live with or whatever at risk. And that's a balance that we're going to have to strike for the next year. We're not entirely sure what that's going to look like, especially given, in terms of like finances for these societies, because, they're student led and student run, and student, finance and things. So yeah, I think that's one of the bigger things that's been on my mind recently, as we're like looking to start the next semester. And I'm also probably going to have to leave now, but like, thank you so much for having me.
Thank you very much, Hannah. We'll be in touch. Thanks again. Lewis, so your plans for recovery and the future in your context in which you're being as a student.
Yeah, I think a lot of us here I've been talking from a relatively professional point of view, I guess, whereas I don't really have that. To be perfectly honest, I don't really have much of a connection to any kind of psychology. And since moving away, I don't really have any young people in my life other than my peers, other than my niece. And she's immunocompromised anyway, so lockdown hasn't changed. And she's not even 2 yet, so to be perfectly honest, she doesn't really care. But I think before lockdown, a lot of I noticed in the last couple of years there's been a little push, just within people, and I guess there's been adverts, I suppose, about just asking your friends, how are you? Really asking, how are you? I know there's been adverts, I remember them, but it's especially with how much more mental health has been a part of people's consciousness, I guess. People are actually thinking about their mental health way more in the last few years. Maybe that's just me growing up a little bit. But before, I think that was kind of an option, it was recommended to ask your friends a bit more, really dive in a bit. But now, as part of this recovery, as part of this moving into this, whatever this new world is we're going into, it's not really recommended anymore. Now it's a necessity, really, isn't it? You really have to check on how your friends are and how your peers or your co-workers are. So I've been getting a little bit better at just calling my friends and my co-workers as well, I guess, just asking how are you? How are you doing? How are you really doing? And some people have nothing to say, and that's fine. But every now and then somebody says, you know what, I'm really getting pretty fed up right now. Can we talk? And yeah, just moving into this strange new time, strange new world. We've all heard these words a million times. It's a necessity now. Like, we just have to. We have to. There's no way around it. You have to ask your friends how you are. You have to ask your peers. You have to be that little bit further. Otherwise, it's kind of hopeless. And again, with the aspect of how we support young children, only person really in my life is my little niece, and like I said, she doesn't really care. But she's yeah, I think lockdown has affected her quite a lot. Obviously, she won't realize, but it has. She's been with her parents way more, so coming up to her language skills have just skyrocketed because she spent so much time around people. It blows every day. It blows my mind how much more she's learned. It's crazy. And yeah, just to be aware that the people who are, I mean, obviously I'm still growing up, but you know, people who are really growing up right now are dealing with something that no one else has really up until this time. And just be aware that it's wild for everyone, and growing up is not fun for many people. And yeah, just being aware in this while we're recovering, while we're moving into this new stage, that everything has changed, and that it's changed for the people who are trying to figure out how it's changed. You know, if that makes sense.
Yeah.
It's a bit rambling, but yeah.
No, absolutely fine. All right, Colin. So just putting the two last questions in, so plans for recovery and within your own organisation, how you're moving forward.
I think Lewis is absolutely right. That fundamental aspect of recovery is talking and giving children the kind of language and the space and the confidence to be able to talk about their experiences of lockdown and not just assume that they can just get back to it. So that's true for children, but it's true for all of us. We were absolutely delighted that the Scottish Government is pressing ahead with incorporation of the UN Convention on the Rights of the Child in this parliamentary term. I don't think we should underestimate the importance of that decision, and it's not being kicked into the long grass. It's absolutely fundamental to the kind of way that as a country we're developing, and also the way we'll emerge from this. So one of the things that we're trying to do is to get people to think about a rights-based aspect to this recovery. In school, if we talk about a recovery curriculum, what does a rights-based recovery curriculum look like? So a bit of a plug, but we'll be publishing a resource called Back to School, backtoschool.scot this week, where there are kind of activities to help educators think about what a rights-based recovery will look like. And essentially that's about rights-based relationships. You know, our rights are experienced day to day. So we want children and adults in school environments to think about kindness and empathy and trust and the idea of human dignity. And if we can underpin our recovery-based relationships with these kind of ideas, then I think we will have a better shot at repairing some of the kind of trauma, some of the difficulties, and changing the way we've always done things, because things do need to be changed. So I think, yeah, I'll just keep getting on that soapbox. That's my plan for the next wee while.
Thank you. Alison, yes.
That's a great soapbox to be on, Colin. I would just stay there if I were you. Yeah, interesting questions. When the schools all closed, I think the 23rd, was it, of March, there was that really rapid trying to get everything changed, people settled into workstations. But by the second week of the Easter holidays, in our service in Glasgow, we were beginning to think about recovery at that point. So we were starting to produce thinking and papers around what we called it the 3 R's: resilience, recovery and reconnection. So trying to encourage both our own staff but our colleagues in schools and in early years to think even at that point about what recovery would look like and what they would have to have in place in order to make that successful and effective. So from our own perspective as psychologists, we decided that we had to really focus in on some core offers, because we knew we wouldn't be able to deliver service as we normally would. Much of it would be home-based, much of it would be online. So we had to really refocus our service planning and our service priorities. And what we decided that we would do is kind of have key features and key features around, here we go again with Glasgow, but around nurture, around understanding child development, around that really key role that adults have in terms of the relationships that they have with children, supporting transitions and understanding individual needs, so that we were able to think individually about children and their families as they return to school, and make sure that the planning that we had in place was as flexible as it could be to accommodate a whole range of needs. We I continue to encourage colleagues to take one of those nurturing principles, which is all behaviours communication, and to understand that children bring the experiences that they've had at home into the school context, and while even our youngest children can't verbalise those and tell us about those experiences, what they can do is tell us through their behaviours. So to understand the range of behaviours that we might see from our children and young people as forms of communicating need, and the role of the adult in interpreting that and making sure that those needs are met. The other things that we've been focusing on in terms of recovery is that children are going to be bringing a range of needs into school. Some have had very, very challenging circumstances to deal with at home. Some of those may have been traumatic, painful, hurtful experiences for them, but encouraging our colleagues not to pathologise children for what are normal responses to an abnormal situation. So we are encouraging our communities and schools to think holistically about a child's experience, and to think about solutions in every aspect of that child's life, rather than going directly to that child and thinking that the solution lies within that child, and to try and have a much broader understanding of the systems that have impacted on children through this period, from the decisions that government have made right down to what that individual family has experienced. We are very clear that we are going to have to target resources and thinking towards those children and families that find it hard to make the adaptations and the adjustments that are going to be required next week. It's coming very soon, and so setting up forums, consultative forums for our colleagues in schools and in nurseries to access the services of educational psychologists even when we can't be with them physically, so that we can problem solve and support each other together, albeit remotely, and keeping children's needs right at the centre. It can be easy to be distracted from actually what our core business is, and that's the well-being of children and young people. And I think the final message is that yes, there will have been learning loss, and that learning loss will be different in different communities. Our schools are fabulous at addressing children's learning needs, of course they are, and that's bred in the bone for our teachers and staff. So to be confident with them about how they will address that, and keeping children's well-being needs right at the centre of that, because when children's well-being needs are met successfully, then they're in the best possible place to access the fabulous learning opportunities that they get in our education system today.
Thanks very much, Alison. Fiona.
Hi there. So I suppose from a really practical point of view, how we're dealing with recovery, so we are starting to get staff back into offices again, walking around with 2-metre sticks and measuring everywhere to ensure that there's appropriate physical distancing with staff, having them in bubbles, and just make sure we're initiating all the hygiene and distancing measures. We're now trying to have as much direct contact with children and families as possible, trying to do as much as we can outdoors. However, the Scottish summer is not being kind to us thus far, so that's been a wee bit difficult. So we'll continue to use face-to-face contact at a distance, and also, as I've mentioned before, that the use of technology. So one of the things that's been quite apparent over lockdown is, for some services, the number of referrals that we've received during lockdown reduced significantly, particularly those that were relying on referrals from GPs, I think just because of people's reluctance to go to GP surgeries or to bother the NHS in the middle of a pandemic. So those had reduced. However, we are anticipating and starting to see a huge increase in those referrals coming in now as lockdown eases. On the other hand, some of our other services, which are more community-based, saw huge spikes in referrals during lockdown, just with people not having access to other means of support like schools and the things that people would normally connect with. So we've had to adapt right through lockdown and go into a different recovery plan every week to really be agile and flexible and respond appropriately to the needs of the children and families and communities that we work in. In terms of what we're going to be doing to support children and young people to manage the new normal, I think all of our work in Children First is informed by the impact of trauma on individuals, their families and communities. We recognise that this pandemic and the resultant restrictions placed on people may have been difficult for some people, particularly those who were already struggling with trauma and poor emotional well-being. I think it's important to keep in mind, though, that everyone's experience of the pandemic and lockdown has been different. So a lot of us have spoken today about some of the benefits of being in lockdown and spending time with our family. So we'll continue to work alongside individuals and families to understand what their experience has been and what it's meant for them. I think some people have mentioned earlier on that for some, coming out of lockdown will be far more challenging than being in lockdown, particularly for children and young people who don't have a particularly positive experience of school. So we're doing a lot of support to children and young people at the moment to really help them into that transition back after a long period away. And for some young people have been clearly saying to us that lockdown's been the best thing that's ever happened. So you can understand why they might struggle now that they're anticipating going back. We'll continue to emphasise the importance of relationships in all our contacts with children, young people and families, and to make sure we have contact with them in the way that's right. We'll continue to provide opportunities for connection, whether that's through physical distancing, virtual groups, and whatever way is appropriate for them. The other thing that's important is we'll continue to work with families to support them to feel confident in providing a secure and contained responses to their children's distress and their challenges in coming out of lockdown. We'll do that through our local services and also through Parentline Scotland. We certainly take the view that families are very important in helping the resilience and recovery of children long term. So we continue to support families, as I say, through our local services and through Parentline Scotland.
Thanks very much, Fiona. And the last presentation goes to you, Laura.
Okay, thank you very much. I think I'm going to echo a lot of what Alison said. At the beginning of lockdown, one of the things we noticed in child and adolescent psychiatry was that the referral rate dropped to some weeks actually having no referrals, which is completely unheard of. And with the young people's unit where I work, there was a point where there were only sort of 6 people in a 12-bed unit, which again is almost unheard of. As you can imagine, we only have 12 beds for the north of Scotland, so it is quite a precious resource. So we are quite surprised by that. But I think what we've seen recently and over the past maybe month is that my feeling is we've kind of been saving things up until now. So although my colleagues in the general hospital, I guess they've kind of dealt with the first sort of peak of people coming into hospital, it feels like in mental health, we're now kind of getting to our peak and things are actually getting a lot busier. With the young people's units full. I think my outpatient colleagues are under kind of a lot of pressure as well with increasing referrals. So I think in terms of recovery, I suppose that the first step is actually to get to more of a kind of steady state and to, I suppose, take a step and back and kind of reassess like some of the people that have been missed during the lockdown that haven't sought help from their GP or haven't had kind of that face-to-face contact. And I think within the NHS, we're starting to see kind of some of that face-to-face contact coming back. We're starting to see some of the screening services and so on coming back as well. So it's kind of getting back to kind of the normal, I suppose the new normal. In terms of supporting young people with the new normal, I suppose one of the things that struck me was that some of the young people that we have in the unit actually have been in the unit throughout lockdown, so because of kind of the major mental illness, they've been in hospital for quite some time, and they aren't even aware of kind of what's happened. So one conversation I had with a young person, I was kind of reading the newspapers to her, and I said, well, how many deaths do you think there's been in the UK today? And she said, I don't know, maybe about 10. And when I told her what the figure was, she was like, oh, that's why you're wearing masks. Like, so I think teaching young people about what's happened is part of that. And again, similar to what Alison said, I think, I mean, I would never underestimate how difficult it must be for some children, young people, the lockdown, and that school has been their safe place. But on the flip side, actually, I have spoken to quite a lot of young people who have felt that lockdown has been really beneficial to them. It's given them a lot of kind of structure and routine to their day. They've had a lot of contact and support from their family. And actually now that things are being eased, they're really kind of struggling with that. So I think, I suppose, supporting transitions and being kind of mindful that there's a lot of uncertainty for young people now, and things are kind of constantly changing, that we have to kind of support young people through that. Thank you.
Thank you for your forbearance. We went over time. That was because all your contributions have been magic, absolutely beautiful. I couldn't have asked for a better set of people to sort of contribute to what was a wee bit of an experiment for our committee. So I'm absolutely delighted that it's gone so well. Thank you so much to all of you for having contributed and given your time.